Hello, and welcome to the snapshot concerning prescription extensions, partials, and emergency fills. This is part of Module 4 of the MCW School of Pharmacy Wisconsin MPJE review. Our first topic will be prescription extensions. A prescription extension refers to a situation in which a patient comes into a pharmacy for a refill, but their prescription has no refills left. And they need maybe a few pills or a small quantity of medication in order to get them by until you can obtain renewal from a doctor's office. So what, as a pharmacist, can you do? In Wisconsin, a pharmacist can provide an extension to a prescription if all of the conditions on this slide are present. So there are a bunch of conditions, so let's go through them. First of all, there are no instructions on the prescription by the prescriber to the contrary, so the prescriber has not prohibited providing an extension. This is rare, but it is a legal option to a prescriber. And of course, the pharmacist cannot reach the prescriber or the office or another covering physician that can provide a renewal for the prescription. So no one is available to renew the prescription. The pharmacist must use their professional judgment to determine that interruption of therapy can have an undesirable consequence for the patient and that the drug is essential for life. So typically these will be chronic drug therapy, so the patient will also be on a consistent drug therapy, and that it will be for a serious condition or a condition in which if the drug is stopped, there could be undesirable consequences. The patient must have had the prescription filled at your pharmacy, or if you're a chain pharmacy, at one of the stores in the chain before. So it can't be the first time that you're filling this prescription for the patient. Our prescription extensions are not allowed for controlled substances, so it has to be a non-controlled substance. Finally, patients are only allowed one extension per prescription, per drug in a year. So an extension has not been provided for that drug within the prior year. So all of these conditions must be true in order to provide a prescription extension. What can a pharmacist do when they determine that a prescription extension can be provided? They can dispense a maximum of a 7-day supply. So this could be a 7-day supply of tablets or capsules, or if the prescription comes in a fixed amount, such as a tube of cream or an inhaler, the smallest available quantity that can be dispensed. So it could be possible that a greater than 7-day supply could be dispensed if it is the smallest available quantity. Finally, the pharmacist must notify the prescriber as soon as possible of the extension, and this is typically done when the renewal request is transmitted when the office is open again. Okay, so maximum of 7-day supply, and be sure and notify the prescriber. So let's take a look at a quick example. Mrs. Horsefeathers comes in and requests a refill of her blood pressure prescription for Procardia XL 30 milligrams, 1 tablet daily, that she has filled at your pharmacy for several years. Upon looking at her profile, you see she is out of refills. You try to contact the prescriber, but it's Saturday, so the office is closed. So, can you provide a prescription extension for Mrs. Horsefeathers in this case? Of course, the answer is yes. So let's take a look at some of the reasons why you can do this, some of the conditions that are present. First of all, it is for Procardia XL medication for her blood pressure. So as a pharmacist, you could judge that stopping this medication would have undesirable consequences. And so this is something that needs to be continued. She's also had it filled at your pharmacy for several years. So it's a chronic medication, and she has had it filled at your pharmacy before. So this satisfies other conditions. It's not a controlled substance, of course. And then the office is unavailable. It's Saturday, and so you are unable to contact the prescriber. So in the absence of any prohibitions by the prescriber to the contrary, you can provide this prescription extension. So how much can you provide? Well, according to our statutes, up to a 7-day supply. So you could provide up to 7 tablets in this case. So since it's 1 tablet daily, you could provide 3, you could provide 7, or whatever works. This is horse feathers. So what do you need to do afterwards? Of course, as we mentioned, notify the prescriber, and of course, try to obtain a renewal on the prescription for the patient. Just a note, in the statutes, there is one section 450.115 BR. This is still there, but it is no longer in force. This was in place during the COVID pandemic, state public health emergency, to allow prescription extensions for up to 30 days rather than 7. But note that the 30-day extension are no longer allowed since that public health emergency has expired, and it is merely a 7-day extension. Let's move on to discussion of partial filling of various types of prescriptions. So we'll discuss non-controlled, Schedule 3 through 5, and Schedule 2. First, let's talk about partial filling of non-controlled substance. So non-controlled substance, of course, may be partially filled, but there are a few statutes and rules around this. On the initial fill, the written quantity must be the quantity that is dispensed, unless the patient has had that same medication filled for that quantity at the pharmacy within the past 2 years. So this is intended for new medications to just fill what was originally written, unless the patient is on a chronic therapy, in which case they may have on that initial fill a quantity dispensed that they've had in the past couple years. On refill, however, the pharmacist may dispense any quantity up to a 90-day supply in a single fill. Of course, this assumes that there is sufficient quantity remaining on the prescription for this. This can be done at the pharmacist's judgment or at a patient request. So, what is my take? My take is that the intent of DEA and PEB is to allow partial filling of Schedules 3 through 5, and that 961.31 gives the board the authority to create these regulations. So in Wisconsin, a pharmacist may partially dispense a prescription for Schedules 3, 4, and 5. And according to DEA, this is also allowable as long as each partial fill is recorded in the same manner as a refill, the total quantity dispensed does not exceed the total quantity prescribed, and we're still paying attention to that 6 months expiration date. Schedule 2 prescriptions get a bit more complicated. So there are several situations we need to look at for Schedule 2s. First of all, repeated partial fills. So partial filling more than once, again and again. This is allowed for Schedule 2 prescriptions only for 2 types of patients, and this is federal and state law. So only patients in long-term care facilities or that are terminally ill may have repeated partial fills of Schedule 2 prescriptions. The designation of the long-term care facility patient or terminally ill must be on the face of the prescription, and this is something you can clarify with the physician. Or a terminal illness must be documented in the patient's med profile. So just as with other partial fills, the pharmacist must record the date, quantity, remaining quantity, and the pharmacist responsible for each fill. Unlike other Schedule 2 prescriptions, which do not have a specified expiration date, repeated partial fill Schedule 2 prescriptions can no longer be filled after 60 days. So a regular Schedule 2 prescription does not have an expiration date. If it is repeatedly partially filled, that triggers a 60-day expiration date by federal regulation. So in Wisconsin, and federally actually, we may fill some Schedule IIs for your typical ambulatory outpatient individual on a one-time basis. So in what situations can this happen? And this is not our long-term care facility or terminally ill, but just a regular individual coming into the pharmacy to fill a Schedule II prescription. So in what situations could these be partially filled? Well, first, the pharmacist is unable to supply the total quantity called for in the prescription. So if the pharmacy is out of stock temporarily and can only fill part of the prescription and will fill the remaining quantity when the drug arrives at the pharmacy again. So that's one situation. Or when the patient requests partial dispensing or the prescribing practitioner requests partial dispensing. This is new in our regulations for Wisconsin. So either the patient or the practitioner can request a one-time partial dispense of a Schedule II prescription. Okay, so any of these situations will result in just a one-time, not repeated, just one time. So after partially filling the Schedule II prescription in any of the above situations, what must a pharmacist do? First of all, note the quantity dispensed originally on the face of the prescription. The remainder in all these situations must be dispensed within 72 hours, even if it's a request by the patient or the prescribing practitioner. 72 hours is the limit. If this doesn't happen, the prescriber must be notified of the quantity that was actually filled. Times come up within this 72 hours. Does it have to be delivered to the patient, or can it just be filled and be awaiting patient pickup? DEA's position is that the remainder must be merely filled and ready for dispensing to the patient and not necessarily delivered to the patient at that 72-hour time. So within this time, the remaining balance could be filled, the prescription could be placed in the pickup bins, and then the patient could come in after the 72 hours and still receive the balance of the medication. I've included this chart of the partial fill rules that prevail in Wisconsin for non-controlled Schedule 3 through 5 and Schedule 2 controlled substance. And this chart is also reproduced in the Moodle modules on the website. Let's move on to discussion of emergency Schedule II prescriptions. For an emergency oral Schedule II prescription, federal law states that there are 3 conditions that must be present in order for this to occur. First of all, the immediate administration of the medication must be necessary. You can't have any delays. That there is not an appropriate non-Schedule II alternative treatment available. And that it is not reasonably possible to provide a written or electronic prescription for this medication at the time. And so the pharmacist is responsible for making sure that all 3 of these conditions are fulfilled for an emergency oral Schedule II prescription. Fortunately, these are generally fairly rare, and even rarer these days with the advent of electronic prescribing and mobile platforms and those types of things. Usually occur on the weekends or in the evenings outside of usual business hours. It's important to note that federal law also states that the prescriber must personally call in that emergency Schedule II. So an agent of the prescriber, a nurse, or other office person may not call it in. It must be the prescriber, him or herself, that calls this in. So in this case, the pharmacist is responsible for the following. So first of all, they have to ensure that the quantity prescribed is limited to an emergency period. So the emergency period only. So no like long-term prescriptions, no 30-day supplies, that type of thing. So it has to be just for a few days until a written prescription or electronic prescription can be transmitted. This has to reduce the prescription to writing, of course, like any other oral prescription, and that it make sure that it contains all information needed for that Schedule II prescription. So prescription information is discussed in another snapshot in this module. The pharmacist must make a reasonable effort that the prescriber is authorized to prescribe. If the pharmacist doesn't know the prescriber over the phone. So this may include talking to the purpose of the medication, obtaining a DEA registration number, or anything else the pharmacist feels is important to make sure that the prescriber is authorized to prescribe this Schedule II. Finally, the pharmacist is responsible for making sure that a written or electronic prescription is received within the appropriate amount of time and attached to the written copy of the emergency prescription. Okay, and this can be attached either physically or electronically if it's an electronic prescription. Now, this covering prescription must be received within 7 days of the emergency prescription. So that is an important time frame to remember. So the covering prescription is received within 7 days and attached to the emergency prescription. So related to this covering prescription, this must exactly match the oral order. Okay, so they can't send in a emergency prescription and then the covering prescription, adds more onto it, so that is not permitted. If the prescriber wants to add more to an emergency prescription, they must issue one prescription to cover the emergency, and then a second prescription for anything beyond that. On the face of the covering prescription, there must be authorization for emergency dispensing words, as well as the date that the oral order was provided. Okay, so that must be on the face of the prescription. Again, a separate prescription for any additional drug quantity. And if the written prescription does not arrive within 7 days, the local DEA office must be informed. So this snapshot has discussed prescription extensions, partial filling, and emergency fills. It's been part of Module 4 of the MCW School of Pharmacy Wisconsin MPJE review, and there's further practice in our companion questions. Thanks, and see you in another snapshot.